Thank you, Zoom. Good morning, everybody.
Good morning.
Just gonna wait for a few more people to hop on, because I know I was late getting the passcode out, so. Everybody. So how's everybody doing today? Tired?
Yes, ma'am. I just got up.
I know. These 3-day clinicals, man, they're killers. They're killers, but we'll get through it. Rodnisha, I will fix that. I haven't got a chance to yet, but I will fix that learning style quiz. I'm going to see what's kind of going on. You said you weren't able to post in it. Is that correct? Rodnisha?
Ma'am,
Were you able, what was the deal with the learning style quiz?
took the learning style quiz and I went to the section that say discussions and it say there's not a place to like insert this one. So I don't know. Yeah, I don't know where to put the screenshot of my learning style.
That's fine. I'm gonna look at it after this meeting and I'm gonna make sure there's a place to put there. Okay.
Okay, thank you.
You're welcome. Okay, guys, so we're gonna get started here a little bit. Okay. Can you guys hear me okay?
Yes, ma'am.
Okay. And Laura says, yes, I'm having the same problem. Okay, so we're gonna get that fixed. Okay. All right, so does anybody have any general questions? Like, how are we feeling about fluid balance and fluid distribution?
I think I'm having problems with the signs and symptoms more than like the lab values.
Okay, all right. Okay, so Are you talking about fluid balance? Or are you talking about electrolytes?
I guess both, maybe.
Both? Okay.
Yes, ma'am.
All right. So when somebody is in, okay, let's talk about the signs and symptoms of dehydration. Okay. So dehydration is when there is not enough fluid that's in the vessel. Okay. So the patient is going to be, when a patient is fluid volume deficit, okay, they are going to be tired. Okay. They're going to have low blood pressure. Okay. They are going to have a weak, thready pulse. Okay. A rapid, thready pulse. Okay. It's going to be fast. The heart rate is going to be fast. Okay. But it's not going to be a strong beat. It's going to be thready. Okay. When somebody is in fluid volume deficit, okay, they're going to have a rapid, thready pulse. Okay. Let's see. I'm sorry. My Wi-Fi is a little crazy, so I may be like behind. Let me see. Like my words may be behind my thing. So let me see. Okay. All right. So try not to move it around. Okay. Yeah. So that is going to be in fluid volume deficit. Okay. The patient is going to be weak. Okay. They're going to have a rapid, thready pulse. Okay. It's not going to be a strong pulse. It's going to be a fast pulse, but it's not going to be a strong pulse. Okay. In fluid volume overload, okay, they're going to have edema. Okay, they're going to have swelling in the lower extremities, which is dependent edema. Okay, because in fluid volume overload, okay, you have too much fluid in that interstitial space. Okay, that's not getting properly put back into the intravascular space. Okay. In fluid volume overload, there's going to be fluid in the vascular space. Okay. There's going to be fluid in the vessel. Okay. But the vessel is going to be overloaded. Okay. It's going to be overloaded with fluid. So it's going to be shooting out that extra water, okay, into the interstitial space. Okay. So that fluid is just going to sit in that interstitial space because it has nowhere to go. And this is in fluid overload. Okay. So the blood vessel, okay, is not going to be able to hold it. Okay. So it's going to leak out into that interstitial space and stay there. That is fluid overload. Okay. So the patient is going to be puffy. They're going to be edematous. Okay. And as far as heart rate with fluid volume overload, okay, these patients are going to have a bounding pulse. Okay, they're going to have a strong pulse because that fluid, that vessel is so overloaded with fluid that the pressure is super high. That hydrostatic pressure that's pushing that fluid through the vessel, okay, is so strong, it's going to cause that strong pulse. Unlike dehydration, okay, where the pulse is going to be weak, okay, because there's no fluid in the vessel. Okay, so there's not going to be a lot of bounding. There's not going to be a lot of pulse. But in fluid volume overload, the pulse is going to be bounding. Now, in fluid volume overload, the pulse can be high or the pulse can be low. Okay, in fluid volume overload. Okay, so it can be either high or low. Whereas in fluid volume deficit or dehydration, our pulse is going to be what? High or low?
They're gonna be high.
Yes. In fluid volume deficit, the pulse is going to be high, but the pulse is going to be weak. It's not going to be bounding. Okay. So it's going to be high, but it's going to be weak. Okay. The rate is going to be high, but the feel of the pulse is going to be weak. Does everybody understand that? I know that's a little crazy. So. Okay. All right. So that's some signs and symptoms of fluid volume deficit and fluid volume overload. Okay. So what are we going to do for the patient in fluid volume deficit? If the patient doesn't have enough fluid and fluid volume deficit, Andrea, what are we going to do for that patient in fluid volume deficit?
You're gonna give them fluids.
That's correct. Okay. We're going to give them fluids. Okay. We're going to either give them IV fluids, or we're going to get them to really take in that PO intake. Okay. We're going to really try to get them to drink a lot of water. Okay. In fluid volume deficit. Okay. What electrolyte loves water, loves fluid? Which one? Y'all remember?
Is it chloride?
No. Think about the salty chips.
Sodium.
Sodium, okay? Sodium and water love each other, okay? They want to be around each other so much, okay? Water wants, more so water wants to be around sodium, okay? If you watch Sarah RN, I don't know if you guys are familiar with her on registerednurse.com, but she's got a lot of great videos. And I love the way she does sodium and water. She says that sodium is the popular kid and water is the unpopular kid. Okay, so water wants to be where sodium is. Okay, so if sodium jumps off a bridge, so is water. Okay, water wants to be where sodium is. Okay, so if you have a high volume of sodium, okay, water is going to be attracted to that. Okay, water is going to want to be there. Okay, so if a patient is in fluid overload, if they have too much fluid, okay, what do we not want to give them? Rodnisha? What electrolyte do we not want to give them?
If they're in fluid volume overload?
Yes, if they're in fluid volume overload and they have too much water, okay, what electrolyte do we not want to give them?
Would you not want to give them sodium?
We don't want to give them sodium. That is correct, okay? Because water loves sodium, okay? So we don't want that sodium coming in and adding more water to what we already have. We already have too much water, okay? We don't want any more water in fluid volume overload. Therefore, we don't want sodium, okay? We don't want sodium. So we're going to put them on a low sodium diet, okay? So that it doesn't attract more water. The vascular space does not attract more water. Okay. So remember that low sodium diet for patients that are in fluid overload. Okay. Also, for patients that are in fluid overload, we're going to want to ambulate them, or we're going to want to move them in bed. Okay. Side to side. Okay. Get that fluid mobilized so that fluid does not stay in one place. Okay, the more it stays in one place, okay, the worse it's going to be. Okay, the more it stays in one place, the harder it is to get out. Okay, so we want that fluid going to other places so that it can be excreted. Okay, so what about a patient that is in renal failure? How are we going to get, that doesn't pee, that doesn't urinate? How are we going to get fluid off of them? Laura? I'm sorry, go ahead, Rodnisha.
Will we give them a diuretic?
Initially you would, okay? But when the patient no longer pees, we're gonna have to put them on dialysis, okay? And the dialysis is gonna get rid of the fluid, okay? Because if you're giving them a diuretic, yes, initially you do wanna give them a diuretic when they're early in the early stages of renal failure. Okay, yes, you would want to give them a diuretic. If they're not in renal failure, you absolutely would give them a diuretic. However, when they're more chronic, okay, if they advance to chronic renal failure and they don't urinate, there's nowhere for that fluid to go. So the only way to get rid of fluid in a chronic renal failure patient that is in fluid overload is by dialysis. Does that make sense?
Yes, ma'am.
Okay. All right. So signs and symptoms. So any other questions regarding fluid volume deficit and fluid volume overload? Rodnisha, did I kind of clarify that a little bit for you as far as those signs and symptoms were concerned?
Yes, ma'am.
Okay. All right. So let's talk about electrolytes. Okay. So signs and symptoms of electrolytes. I don't want you guys to don't get too bogged down with signs and symptoms. Okay. Like I said, I want you to only think of the part of the body that particular electrolyte is affecting. Okay. Like I said, sodium, you want to think brain. Okay, you want to think brain symptoms, okay? Weakness, seizures, fatigue, okay? Anything brain related, I want you to think sodium, okay? Potassium, I want you to think heart, mostly heart. Other little bitty one I want you to think of, because the heart is a muscle. That's right. So a lot of heart, a little bit of muscle. Okay. So it's going to mostly affect the heart, but it will affect the muscles as well. Okay. So potassium. So your signs and symptoms or heart symptoms are going to be cardiac dysrhythmias in both hyperkalemia and hypokalemia. Okay, it's going to be in both. Okay. Muscle, as far as muscle, okay, in hypokalemia, okay, you are going to have, in hypokalemia, you're going to have the weakness of the muscles. Let me make sure I'm telling you that. I don't want you to, let me see, hang on. Let me just make sure I'm telling you right. Hold on. Hypokalemia. All right. Muscle cramping or muscle fatigue. Okay. It can, again, same thing as heart. Okay. So there's another one. You're either going to have muscle cramping with hypokalemia or hyperkalemia. Okay. It's going to be both. Just like with cardiac dysrhythmias, it's either going to be, you're either going to have it with hypokalemia or hyperkalemia. Okay. Oh, what's the differentiating symptom between hyponatremia and hypernatremia?
Is it a constipation and diarrhea?
There's one particular symptom that is going to differentiate a patient with hyposodium and hypersodium.
Thirst.
Thirst, yes. In hypernatremia, okay, the patient is going to be thirsty. In hyponatremia, they're not going to be thirsty. Okay, so know that, very, very important. Okay, so back to kalemia, back to potassium. So in hypokalemia and hyperkalemia, okay, you're still going to have cardiac dysrhythmias. Okay, you're going to have funky heart sounds going on. Okay, in either hypo or hyper. As far as muscle, you're going to have muscle weakness and muscle cramping in both hypo and hyper. Okay, there's really no differentiating symptom, sign and symptom between, oh, there is, I'm sorry, there is, okay. The T wave, okay, the T wave on an EKG is going to be what in hypokalemia? Is it going to be low or high?
Low.
Low, okay. And hypokalemia, remember also in class I said kalemia, potassium, you want to think of doing stuff. You want to think of the action potential, okay. So in hypokalemia, we're not doing stuff, okay. So everything is going to be low, okay, low T wave, okay. Constipation will be in hypokalemia. Okay, Rodnisha brought in constipation and diarrhea. Okay, constipation is going to be in hypokalemia because it's low. We're not doing anything. Okay, whereas in hyperkalemia, we're doing a lot. We're excited. Okay, so it's going to be a high T wave. It's going to be a peaked T wave. Okay, in hyperkalemia. And we're going to have what GI symptom are we going to have in hyperkalemia, Laura?
We're going to have diarrhea.
Diarrhea, that's correct. Everything's excited. That stool is moving too fast through the GI tract and it's diarrhea. Okay, so too much excitement. Okay, we're super excited in hyperkalemia. Okay, but in hypokalemia, we're so tired. We don't feel like doing anything. Okay, so that can be a I said there was no differentiating symptoms, but that's how you need to think about hypo versus hyperkalemia. Okay, think cardiac and think doing stuff. Okay, are we doing stuff in hypokalemia? No, we're not. Okay, we're weak. We're depressed. We don't feel like doing anything. And hyperkalemia, we're excited. We're all about it. Okay, we're doing all kinds of stuff. We may be too excited. Okay, does everybody understand that?
Yes, ma'am.
Okay. All right. So that's the kalemia. Okay. Calcemia. Okay. Calcium. All right. I want you to think of one word: lazy. Lazy, lazy, lazy. Think of the word lazy. If you have to write it on your test, calcium equals lazy. Okay. Because you guys are allowed to write on your test, just not on your answer sheet. Okay. You guys are allowed to write all over your test. Okay. So the best thing I would tell you to do, okay, before you even look at the questions, okay, go to the test and write sodium equals brain, potassium equals heart, muscle, doing stuff, calcium equals lazy. Okay, get that in your brain, put that on your test. Okay, same thing for acid base. Go ahead and put your normals on the test. Okay, so you get that out of the way, you get that out of your brain, it's on your paper. Okay, so that when you do have a question, you can go back and look at that. That is the best advice I can give to you about that. Okay, that's I mean, a lot of students struggle with fluid and electrolytes and acid base. When I told them to do that, they were like, that made it so much better because I wasn't as anxious. I had it on the paper. I could just go back and refer to it. Okay, so little tip. All right, so back to calcium. Okay, so calcium, laziness. Okay, so don't let it confuse you, okay? Because I know it gets it's kind of like how it shouldn't be, but it is, okay? In hypocalcemia, you have too much laziness, okay? So I say too much laziness. So Rodnisha, what do you think your signs and symptoms are going to be when I say too much? Scratch what I just said, guys. Hold on, I'm confusing myself. Hypocalcemia is not enough laziness. Hypocalcemia, not enough laziness. So now, Rodnisha, that I say that, okay, what are you going to think is going to be your signs and symptoms of hypocalcemia? Not enough laziness.
So like, I don't know, everything is gonna be high.
Yes. You're going to be excited.
And you said
Everything's going to be excited.
hypercalcemia?
Huh?
You said hypercalcemia, right?
Hypo.
Hypo.
Okay, like I said, it's completely different than how your brain is used to processing it, okay?
Yes, ma'am.
That's why you don't want to that's why when you got to put it on your test, okay? Write it on your test. Lazy, hypocalcemia, not enough laziness, little laziness, okay? Hypercalcemia, too much laziness, okay? And that'll get your brain thinking, okay, hypocalcemia, not enough laziness, little laziness. Okay, what's little laziness? Everything's going to be excited, okay? Everything's going to be crazy. We're going to have diarrhea and hypocalcemia, okay? Because we got too much excitement going on, because we don't have enough laziness, okay, and hypocalcemia, okay? And I know it gets confusing. That's why I need you to write it on your test. It'll help you so much, okay, not to get confused. Write the word lazy, okay, and then write hypocalcemia, little laziness. Everything's excited, okay? Hypercalcemia, too much laziness, everything's weak. Okay, so it's the opposite of what you think it would be. That's why you need to write it on the test. So you have it on the test and you can go back and not get confused. Does that help, Rodnisha? Or are you still out of your mind confused?
No, ma'am, it helps.
Okay. All right. So that's what you need to do. Okay. So calcium, hypocalcemia. Okay. Not enough laziness, little laziness. Okay. Too much excitability. So this is where your muscle cramping is going to go. Your muscles are going to go crazy, crazy, crazy. Okay. You're going to have diarrhea. Okay. You may have a little bit of cardiac dysrhythmias. However, with cardiac dysrhythmias, I want you to think potassiums more so than calcium. Okay. I just want you to think excitability. Okay. I'm going to turn my video off because this is really like screwing me up. Hold on. Because my video and my words are not coinciding. Hold on. And I think if I stop it, okay. That is my dog, Mia. Okay. So I have her on the page. So when I do a Zoom call, she pops up. Okay. All right. So can you guys hear me now?
Yes, ma'am.
Okay. All right. Okay. So everything in hypocalcemia is excited. Okay. We have muscle cramping. Okay. We have diarrhea. Okay. In hypercalcemia, we have too much laziness. Okay. High laziness, too much laziness. We're lazy. We're super lazy in hypercalcemia. Okay. which means everything is slow, and hypercalcemia. Okay, we're going to have constipation. We're going to have muscle weakness. Okay, we're going to have lethargy. Okay, we're not going to feel like doing anything in hypercalcemia. Okay, and magnesium, okay, magnesium is going to be the same as which one? Do y'all remember? Is going to be very similar. It's going to have the similar signs and symptoms.
Hypocalcemia.
It's going to have the same symptoms as calcemia in general. Okay, so the same symptoms you're going to have in hypocalcemia, okay, you're going to have in hypomagnesium. Okay, the symptoms that have in hypercalcemia, you're going to have the same in hypermagnesium. Okay, because remember, there's, even though they're balanced, okay, in the muscle, okay, you're still going to have it's a subtle balance. It's a really small balance. Okay, so those signs and symptoms are going to be almost exactly alike. Okay, so very similar symptoms, except, well, no, hypomagnesium, okay, you're going to have hypotension. You're going to have low blood pressure. Okay, whereas in hypocalcemia, you may not have hypotension, low blood pressure. Okay, so in hypocalcemia, not really blood pressure. Okay, no blood pressure related. Okay, but in hypomagnesium, you will have low blood pressure. Okay, so that's kind of a different type of symptom between calcemia and magnesium. Okay. Let's see. So calcium, I'm going through. Okay. What do y'all remember what electrolytes are balanced in the kidneys? Which particular two are balanced in the kidneys? Remember that chart that I made in class? And it should be on your Canvas as well. What you think, Radnisha? Which two electrolytes are balanced in the kidneys?
I want to say bicarbonate. No.
No, that's
sodium and
you're thinking right. That comes in with acid base. Okay, that comes in with acid base. So you're thinking on the right track. But as far as electrolytes, okay, it's the big two: sodium
and potassium.
and potassium.
I said that the first.
You're on the right track. You're thinking, okay, that's right. And acid base, that is true. Okay, when the lungs are in trouble in acid base, which we're going to get to, okay, that bestie, the kidney, okay, is going to secrete bicarb, okay, to help out the lungs. So you're thinking on the right track, okay? But as far as the electrolyte itself, the two main electrolytes is going to be sodium and potassium, okay? That's going to be balanced in the kidneys, okay? In the heart, what two electrolytes are mostly balanced in the heart, Laura?
Is it potassium and
What is the heart? The heart is a
muscle.
Okay. So it's going to be potassium and it's going to be calcium. Okay. Because calcium, remember, we say lazy. Okay, we think laziness when we think symptoms, okay, but we also think muscle and calcium too, okay, more so than potassium. Potassium is heart and a little bit of muscle, okay. Calcium is muscle. Calcium is all muscle, okay. So in the heart, potassium, okay, and calcium are going to be regulated in the heart. Okay. So those are going to be regulated in the heart. Okay. In the parathyroid, you're going to have calcium and phosphorus that are going to be balanced. Okay, calcium and phosphorus. Okay, those two are going to be balanced in the parathyroid. Okay, so like I said, if you have any kind of issues with those particular organs, the kidney, the heart, the parathyroid, or even the muscle, okay, all those balances are going to be thrown off. Okay, and everything that you thought was balanced is all going to be messed around and all crazy. Okay, so those are the organs that those electrolytes are balanced in. Okay, not necessarily signs and symptoms, okay, but they're balanced there. Okay, so brain, signs and symptoms, I want you to think sodium. Sodium equals brain. Potassium equals heart. Okay. Calcium equals laziness, muscle. Laziness, muscle. Magnesium, okay, is going to be also muscle and laziness. It's going to be similar to calcium. The symptoms are going to be similar to calcium. Any questions there? Anything that I need to clarify?
Can you go over the lab values? Which one do you want us to use? The one on the PowerPoints or the one?
The one I told, the one in the chart that I wrote on the board. Calcium, you break a bone, you call
911.
911. That's what I want you to know for calcium. Okay, that's the lab values I want you to know for calcium. Okay, potassium 3.5 to 5. No, I'm sorry. Did I say calcium? Potassium 3.5 to 5. Calcium 911. Sodium 135 to 145. Magnesium 1.6 to 2.6. Whichever one, I think, is that what's on the whichever one is on the chart that I did in class, and that's on your Canvas. Okay, does that answer your question, Laura?
Yes, ma'am.
Okay. Okay. Any other issues with fluid and electrolytes for right now? How are we feeling?
I feel better.
I feel better.
You feel better. Okay. All right. Okay, good. All right. Make sure, like I said, review that. If you still kind of feeling a little anxious about fluid balance, okay, review that YouTube video that I put on about from Ivy League Nursing about how fluid goes in. It goes in, it goes in through hydrostatic pressure, okay? It goes in through the blood vessel, then it goes down the capillaries and goes into the cells, okay? The cells are going to use what they need to use, and any other trash, okay, or water or whatever other stuff is going to go into the interstitial space, okay? So then the blood vessel, okay, if everything is great and we're at a homeostasis state where everything is beautiful and everything is going great, okay? When we're at that state, okay, the blood vessels are going to say, hey, there's too much water in the interstitial space, okay? I need to put my siren on for my COP, okay? My COP pressure, my colloidal osmotic pressure. What does a COP do? Pulls you over, okay? So that blood vessel is going to pull that fluid from the interstitial space back into the blood vessel. Okay. So it's a wonderful video. If you're still feeling weird about fluid balance and distribution, go look at that video. It's really, really good. Okay. And like I said, electrolytes, just remember two things. Okay. As far as signs and symptoms, remember the word that I told you to think about with the particular electrolyte. Brain equals sodium. Potassium equals heart. Okay. Calcium equals lazy and muscle. Okay. Magnesium, same, lazy muscle. Okay. Except for hypotension. Okay. Hypotension, low blood pressure, is going to be in hypomagnesium. Okay. All right. So moving on now to acid base. Okay. Acid base is really the only definite thing you will learn in nursing school. It's either one or the other. Okay. Everything else is going to be, there's going to be a little bit of this, there's going to be a little bit of that. It can be both. Okay. Acid base, that is the one good thing about acid base. It's either yes, it's either they fall into this category, they either fall into respiratory alkalosis, respiratory acidosis, metabolic alkalosis, or metabolic acidosis, okay? Or they're normal, okay? So 5 categories, they're gonna fall into one of them, okay? So you need to know for acid base, okay? You need to know the pH first, okay? The pH is going to tell you what, Andrea? Whether they're going to be
Acidosis or alkalosis.
correct. Whether they're going to be acidotic or alkalotic, okay? So a patient that's going to be acidotic, Rodnisha, is going to be less than what?
7.35.
That's right. Yes, ma'am. Okay. A patient that's going to be less than 7.35 is going to be acidotic. Okay. A patient that's pH is over 7.45 is going to be alkalotic. Okay. They're going to be in alkalosis. Okay. That is another thing you need to put on your test right away. Okay. Your normal values for acid base. pH 7.35 to 7.45. Okay. CO2, you drop the 7, you have your your CO2, 35 to 45. Okay. And then bicarb, there's no really freaky way to know that. You just have to memorize 22 to 26. Okay. So you want to go write that on your test when you get it. Okay. pH 7.35 to 7.45, CO2 35 to 45, bicarb 22 to 26. Like I said, you do not have to know if it's compensated or uncompensated. We're not going to go into that. Okay. So if you have those values on your test, okay, and you also are going to write what acronym, Rodnisha?
Rome.
What abbreviations?
Rome.
Rome. That's right. ROME. Okay. Respiratory opposite, metabolic equal. Okay. So for acid base, you write those normal values, the pH, the CO2, and the HCO3, and then you write the acronym ROME. Okay. So you have that on your paper. Something else you don't have to think about. Okay. You have that written down. It's good to go. You're ready to go. Okay. So respiratory, okay, whether it be alkalosis or acidosis, the CO2 and the HCO3 is going to be opposite. They're going to be going in opposite different directions. Okay. In metabolic, okay, the CO2 and the bicarb are going to be going in the same or equal direction. Okay. So if you need to put, E is equal, but you also need to write same, Okay, do that, whatever you need to do to help you to remember it. Okay, because those the CO2 and the HCO3 is going to be going in the same direction in metabolic, either it be acidosis or alkalosis, depending on the pH. Okay, all right, signs and symptoms. Okay, this is where it gets a little tricky. All right, so we got to think of when signs and symptoms come, we need to think of the BFF analogy. Okay, all right, so if the kidneys are in trouble, the lungs are the BFF. Okay, the lungs are going to help and going to come and help out. Okay, so when you either have metabolic acidosis or metabolic alkalosis, the lungs are going to kick in some kind of way. Okay, they're going to either hold on to CO2, okay, or they're going to get the body to release CO2. Okay, either way, the lungs are coming to help, and that's how the lungs are coming to help. Okay, so those are the signs and symptoms you have to think of when a patient is in metabolic, okay, in metabolic alkalosis or metabolic acidosis. You need to think, okay, the lungs, the BFF, so I need to look at lung symptoms. Hyperventilation, okay, okay, that is going to happen, okay, in metabolic acidosis, okay. The kidneys holding on, or I should say this, the kidney doesn't have enough bicarb, okay, or no, I'm sorry, scratch that. The kidney has to, hold on, I need to think. In metabolic acidosis, okay, in metabolic acidosis, the kidney does not have enough bicarb. Okay, so the lungs are going to blow off, doesn't have enough bicarb, so the lungs are gonna blow off the CO2 to make the bicarb and the CO2 equal. Okay, so it's gonna blow off the CO2, okay, so that the bicarb can come up. Okay, and metabolic acidosis. And it's also, okay, gonna get rid of those extra acid ions that are happening in metabolic acidosis. Okay, so if the kidneys are in trouble, okay, the BFF, the lungs, are gonna come and help. Okay? And they're gonna do something to the body that is lung related. Okay, they're either going to tell the patient to blow it off, or they're going to get the patient to retain it. Okay, retain the CO2. Okay, the brain is going to tell if they tell them to retain the CO2, okay, the brain is going to tell the lungs, okay, you need to slow down. Okay, we need to hold on to that CO2 because our BFF, the kidneys, are in trouble. Okay, so and that will be in metabolic alkalosis. Okay, in metabolic alkalosis, the kidneys are holding on to too much bicarb. Okay, so if we have too much bicarb, we need more CO2. We need more carbon dioxide. Okay, so the lungs are going to help. The lungs are the BFF in the situation. They're going to help and hold on to that CO2. Okay, does that make sense? How are we feeling about that? I know that gets a little confusing.
I feel good.
You feel good. Andrea, Rodnisha, how y'all feel about that?
Good, but Miss Adams, I just want to verify. So you said hypotension is with hypomagnesemia, or was it hyper?
Hypo.
Okay.
Hypomagnesemia, hypotension.
Thank you.
You're welcome. Okay. Rodnisha, how about you? What you feeling like?
I feel good.
Okay. All right. Okay. So like I said, this is y'all time. Okay. So if there's something that y'all don't understand, okay, and that y'all are absolutely not getting, okay, y'all need to let me know so I can clarify it for you. Okay. All right. So that is metabolic. Metabolic alkalosis or metabolic acidosis or alkalosis. If it's metabolic, that means the kidneys are in trouble and the lung is the BFF that is going to come and help. Okay. Now, opposite. Okay. If the lungs are in trouble, okay, the lungs are in trouble, you have respiratory acidosis or respiratory alkalosis. Okay. The BFF, the kidney, okay, is going to come help it. Okay. The kidney is either going to hold on to bicarb or it's going to excrete bicarb, okay, to get that CO2, to level out the CO2 that's either too much or too little in the lungs, okay? So that is how the kidneys are going to respond and help out, okay, the lungs in trouble. Okay, again, it's all about maintaining that homeostatic environment, that even keel, wonderful, beautiful, equal spot. Okay. All right. So again, the kidneys are either going to hold on. Okay. The kidney tubules, okay, are either going to reabsorb the bicarb. Okay. So in acidosis, okay, if you have respiratory acidosis, the BFF, the kidney, is going to come in and help by reabsorbing the bicarb in the kidney tubules. Okay. If you have respiratory alkalosis, okay, where you don't have enough CO2, okay, the kidney is going to respond, okay, by peeing out all the bicarb. So it keeps the bicarb and the CO2 on the same level, okay? Until the kidney, okay, until the lungs are out of the woods and they can start making their own CO2 again. Okay, that's what's going to happen. That's how the BFF, the kidneys are going to come in and help. Okay. Any questions there? Okay, so the kidney and the lungs are BFFs when it comes to acid base. Okay, any questions? Okay. All right. Let's see. Okay, so that's acid base. All right, so let's go to infection control. Okay, so we kind of ran over this in class. Okay, infection control. So I'm gonna go through this. Hang on, guys. Infection control, okay, I need you to know, okay, like Rodnisha emailed me before, and I just need you to know, okay, about the little firemen, okay? The little firemen are going to be your antibodies that are going to come in and they are going to put the fire out, okay? The antigen, okay, let's go through it. We're going to go through the process, okay? So you have an infection, okay? This infection comes into your body, okay? First thing that's going to happen, you're going to have antigens, okay, that are going to go and attach itself to that foreign body, okay? It's going to mark it, okay? It's going to say, hey, I got something that does not belong in here, okay? I need my little fireman, okay, to come and put it out. Okay, so the antigen is actually going to cause the antigen, the one that marks it, that marks that foreign invader, is going to tell the body first to start a fire. Okay, it's going to tell the body to start inflammation, start the fire. Okay, what do we do when we start a fire? We want to get rid of things, right? We want to burn them to the ground. We don't want them in the body. Okay, so that's what the antigens are going to do. Okay, the antigens are going to start the fire. Okay, so once the antigens start the fire, okay, the little firemen, the antibodies, come running to it. Okay, so the antibodies are going to put out the fire. Okay, they're going to eat up the trash and they're going to get rid of it. Okay, they are also going to remember it too. Okay, they're going to eat it up, they're going to get rid of the trash, and they're going to remember it. Okay, they're going to remember that foreign invader. So when that foreign invader tries to come back, okay, those little firemen, those antibodies are going to be like, whoa, he's back, we got to go get him. Okay, so they're going to get him. Okay, so not only do antibodies destroy the foreign invader, but they also remember them. Okay, they're called memory cells, memory T cells and memory B cells. Okay, that's all part of the antibody system. Okay, so that's basically what happens in an infection. Okay, so you have the antigen that comes in, marks it, starts a fire, starts the inflammatory process. Okay, and then the inflammatory process starts the immune process. It starts the little firemen to come and put out the fire, eat the fire, get rid of everything there. It also remembers it and when it comes back. Any questions there? So if you understand that infection process, okay, you can kind of understand why we do what we do. Okay, and as far as the infection control, the infection chain, okay, all I want you to know about that is that as healthcare providers, okay, the way we deal with that infection control, that infection process, that infection chain, okay, is we break those chains. Okay, we either break the chain between the portal of entry and the host. Okay, we break the chain between, I don't know, what's the other one? Let me see. Between the portal of exit and the reservoir. Okay, it's all about breaking the chains. Okay, yeah, so that is what we want to do as nurses, okay, as healthcare providers, break that chain. Okay, which infectious disease, okay, does hand sanitizer not work for?
C. diff.
C. diff, okay, very important. C. diff, you must wash your hands with soap and water. Alcohol-based sanitizers, hand sanitizers do not work in C. diff. Very, very important. Okay, let me see. Okay, so the body's defense mechanisms. So we have 4 of them, right? Okay, we have the skin, which is the first one. Okay, we have the let's see, we have the skin and the good bacteria. Okay, such as our probiotics, okay, the good bacteria that fight the bad bacteria, okay. That is why we want our patients to take their whole course of antibiotics, okay, because if they don't take their whole course of antibiotics, okay, the antibiotics are going to attack the good bacteria too, okay. So we don't want that. The antibiotics are either going to attack the good bacteria or the bad bacteria that's not getting rid of, okay, the bad bacteria that we're trying to get rid of, okay, is going to start attacking the good bacteria, okay? So that is why we have to have our patients take their antibiotics for the full course and don't just stop when they start feeling better, okay? Because we want that good bacteria there. That good bacteria needs to stay there, okay? Does that make sense? Some people get a little confused with that. Okay. All right. So we have the skin, we have the good bacteria. Okay. We have the inflammatory response when that antigen comes in to the foreign invader and it starts the fire. Okay. That's the inflammatory response. And then we have our immune response, which is all the little firemen that are coming in to put out the fire, eat whatever's left with macrophage and phagocytosis. Okay, that's eating. Okay, and they remember it with the memory cells. Okay. I think of what else. Okay. All right, airborne precautions. Okay, the different kind of precautions that you have, standard precautions, okay, which is just hand hygiene, gloves, and if need be, if you feel like the patient is going to splatter all over you, then you wear your mask and gowns and all that. Okay, but standard precautions is normally just gloves and hand washing. Okay. Transmission-based precautions, okay, are going to be your airborne precautions, okay, which is going to be your TB stuff, TB, and now COVID-19, okay, that is going to be your airborne precautions, okay. You're going to have an N95, and the patient is going to be in a private room with regulated airflow, okay. You're going to have a specific machine. Some places can actually make a regular room into a TB room by putting this particular airflow system in there. Okay. Sometimes some hospitals already have the airflow system built in. Okay. So it's called the TB room. So in case somebody has TB, they can put that patient in there. Okay. Droplet precautions are going to be just wearing a mask, okay? Just wearing a paper mask, such as RSV in children, the flu, diphtheria, pneumonia, okay? And it depends on how severe the pneumonia is, okay? Mostly for respiratory type symptoms like the flu and RSV in kids, are you just going to wear the mask, okay? But in COVID-19, if you have a patient that you're taking care of with COVID-19, you have to wear that N95 mask when you go. That is considered an airborne precaution. Okay. Contact precautions. Okay. Does anybody know or remember what do we use for contact precautions? I mean, I'm sorry, what disease process would require contact precautions?
Is C. diff one?
I'm sorry?
C. diff?
C. diff, yes. MRSA, yes. Yes, okay. Contact precautions is when you have mask, gloves, and gown, okay? Every time you go in that room, contact precautions. If you are at risk for contacting the patient, if you are touching the patient in any sort of way, okay, or you have the potential to touch the patient in any kind of way, you need to maintain contact precautions, okay, in those particular diseases, MRSA, C. diff, VRE is another one, vancomycin resistant enterococcus, okay? So MRSA, VRE, C. diff are gonna be the ones most commonly that you're gonna see that you're gonna need to do contact precautions with, okay? Any other questions there? Are our elderly folks less susceptible or more susceptible to infectious disease?
More.
More, right. Okay, oh, Rodnisha got kicked out. Okay, okay. Rodnisha, you here? Okay. Yeah, so, you gotta get, she might have to leave. Yeah, so anything regarding the elderly is going to be decreased. Okay, decreased immune system. Okay, so they're going to be more susceptible to infections. Okay, so you need to know that. You guys need to know how to put on and take off your PPE. That's in your book, okay? So make sure you know that, okay? How do you take off PPE? How do you put on PPE? What's the order? Okay, make sure you know that. Okay, and as far as infection control, that's pretty much it. Do you guys have any other questions? Any other issues or subjects that you need me to look over or explain or clarify?
Do we need to know about infection surveillance and reporting?
No. No, not really. You just need to know, you need to know like the signs and symptoms of when a patient is starting an infection, okay? Their temperature is going to be high, okay? That's number one, okay? You need to know they may shiver and sweat, okay? All right. Infections, so I don't have my book with me, so I mean, you want to know, like, okay, blood cultures are going to tell you, you want to know what blood cultures tell you, okay? They're going to tell you what the bacteria is in the blood, what it's resistance to, and what is going to kill it, okay? That is what blood cultures tell you, okay? What's the bacteria? What's the antibiotic that's it's resistant to, and what's the antibiotic that's going to kill it? Okay. Mainly in a surveillance and that sort of thing is kind of what you need to know for that. Anything else? Okay. The best thing, guys, I can tell you guys is make sure you go over your Kahoots, know your Kahoots. Okay. Know the things that we went over here and in class that I said was very, very, very important. Okay. That is going to be on your test. Okay. You should do well if you know your Kahoots and you know those elder adult care points and those clinical cues that are in your books, you should do fine. Okay. All right, if there's no other questions, then I'm going to go ahead and leave, okay? If you guys have any other questions, you can email me before the test this weekend, okay? No problem. I will get back to you before the test, I promise.
Thank you.
All right,
Thank you.
y'all welcome. Have a good weekend.